Alrighty guys, so what is going on? Charlie Entertaining here, and welcome to a reaction video. Now, today I'm reacting to a very special video, but before I start this video, of course, you guys can see the title is, it is a Dr. Mike video. It is called 100 Plus Doctors Tell You the Truth About Battling Coronavirus. I love this video because I get to hear all the opinions of the doctors. I watched like 2 minutes of it so far, and like I said, I like it a lot. Before I start the video, I want to say thanks to my mom because she, right now, I heard a call from her Amazon place saying that somebody on April 18th tested positive for the coronavirus who worked at her place. I want to thank her. I want to thank my brother. He works at Dollar General. He's told me multiple stories about people coming in who have recovered from COVID-19. I pray for their safety every fucking day. I really do. God helps me every fucking day when it comes to praying for my family. I want to thank all those people. I want to thank everybody. But I do want to get into this video. I am going to restart it from the beginning because I know some people don't like it when I don't do that. But also because it is very important for you guys to hear this shit. So let's get into this video.
Hey guys, this novel coronavirus pandemic has truly affected all of us across the globe. But one of the hardest hit communities has been healthcare frontline workers. This means doctors.
I can't deny that. I keep saying I'm tired of hearing people thanking just the doctors, just the frontline workers, just the doctors. Because I want everybody to be thanked. But I do understand how hard doctors are hit. I do feel their pain. I heard somebody say in this video, before I even start this video, if you're interested in this video, a mother said that she had to go through a 30-minute every night she has to go through a 30-minute decontamination session before she can even hug her kids. I couldn't imagine.
Nurses, CMAs, respiratory therapists, technicians, custodial staff, and so many more. Today I'd like to take a focus and celebrate doctors in memory of those who've laid down their lives in the battle against COVID-19. I sat down and I interviewed over 100 physicians to get their take, their experiences, and learn their perspectives about the coronavirus. Know that all the revenue generated from this video, AdSense, donations, and even merch sales, linked down below, are all going to the CDC Foundation to help continue this battle against COVID-19. The first question I asked these doctors, what do you think is not getting enough attention?
I wish there was more credit and awareness being given to other members of the healthcare teams aside from just the doctors and the nurses.
Techs, transporters, housekeeping, kitchen staff, valets, operators.
X-ray, laboratory, radiology techs, EMTs, janitorial staff.
Cafeteria workers, the respiratory therapists, the nurses, and everyone else here on the front lines is towards our ability to do our jobs.
The number of doctors and healthcare professionals out there who've gotten seriously ill and even lost their lives fighting this disease.
Some healthcare workers have been disciplined for speaking up about the lack of personal protection.
Which is fucking ridiculous, bro. My brother made a video one time trashing his fucking boss at Dollar General because he would not give them PPE. He would not give them any personal protective equipment. He wouldn't give them gloves. He wouldn't provide hand sanitizer. And they can't even buy hand sanitizer at their own fucking stores. Solely Entertainment TV. Please go subscribe to his channel right fucking now. That's my brother. He's amazing. He works hard as shit. He walks 2 miles to work every day, and he walks 2 miles home every day because my mom works hard as shit as well. Everybody in my family works fucking hard, man. I applaud everybody in my family during this fucking pandemic.
Equipment.
Testing is an area we need.
Even my dad, he works at a pizzeria, but he could even still get infected from this bullshit.
A huge amount of focus on and attention on in the UK.
We need antibody tests. We need to know who has immunity.
In many communities, the small number of cases being reported is simply...
And the thing that sucks, I'm going to pause this video a lot, I guess. The thing that sucks is that most of these fucking antibody tests that were first brought in during this pandemic were fucking fake. They were fraudulent. And you are so disgusting to make a fake fucking test to test for immunity. You are so fucking disgusting. Anybody who throws their masks or their gloves on the floor, on the ground, every time I see one of those outside, I say you are fucking disgusting, because that's exactly what you are.
reflection of lack of testing.
How coronavirus is and will affect certain communities. Our homeless community, our community of people with special needs.
The domestic abuse and domestic violence that is happening during a pandemic, with victims being in the same home as perpetrators for longer periods of time in this quarantine.
We've limited and cut the number of visits a woman can have before she delivers.
Visitors, family, really no one is allowed to be at the bedside when you're infected with COVID.
If you look closely, you will see that there are young people who are otherwise well who can get seriously ill.
We can't really see the emotional toll that the outbreak has on us.
The effect that this is all having on our mental health and well-being.
Mental health problems don't stop just because we have an infectious disease pandemic.
I've had patients who haven't been able to get cancer surgery, who've had significant heart problems and not been able to get them worked up.
If people who now feel sick from cancer are now discouraged from going to hospitals because all the attention now is on COVID-19, then we're gonna miss some of those patients.
Right now, we're postponing all the non-urgent cases, and when things are lifted.
Hold up, guys. I gotta respond to this. Alright, that was my brother texting me. Like I said, go subscribe to Solar Entertainment TV. Alright, let's keep going. I had to mute him just so I can finish this video, but I will be texting him after I am done watching.
If we're gonna see everyone come back all at once.
How is one supposed to date in this point in time? Are we just supposed to get to know people by Zoom and FaceTime?
Yeah, virtual dating is a thing now. For my next question, I asked, what does it mean for you to be a doctor now?
It means...
I love this part, man. There's so many inspiring doctors during this, man. Like, watching Dr. Mike has made me want to, like, get into the field of medicine, like, study it, because him talking about infectious disease, he's so smart, man. He's not even 30 years old yet, and he knows so fucking much about the medical community. He knows so much about the science. He knows so much about diseases and fucking conditions and everything, man. He's a fucking boss. He's an OG fucking doctor, dog.
A 30-minute decontamination routine before I get to hug my kids every time I come home
Can you
from the
imagine?
hospital.
Practicing medicine during this pandemic means what it always means. Protecting the vulnerable.
This is a once-in-a-lifetime opportunity to boldly fulfill my oath and desire to save lives.
The COVID-19 pandemic has me in a place where I've never felt more connected to my profession.
I have an opportunity to step up and really honor my oath.
I really feel like it's a privilege for me to be able to practice medicine during the pandemic. It allows me to serve my community when my community needs me most.
I'm old enough to have lived through the early years of the AIDS
This is where I
epidemic and had
stopped.
a similar feeling. You were in the middle of something incredibly important.
My mother gave me a magnet a long time ago that said, not all heroes wear capes. Some of them wear stethoscopes.
I'm not running away from it. I'm running toward it.
We're ready. We signed up for this. We took an oath.
It's a privilege to be part of the solution.
It's an honor to care for patients and their families and to help navigate them through these very challenging times.
Medicine is a calling and a vocation. I've never viewed it as a job.
This isn't a job. This is a calling.
I couldn't agree more. Next, I asked, how have you been personally affected by the coronavirus?
When we put a breathing tube in for a patient, which we have to do for almost every surgery, we're really exposed to everything that's in that patient's mouth or throat or airway. It's like looking down the barrel of a gun.
I'll be moving out of our house soon and into some place that's closer to the hospital and where I won't risk infecting my own family.
Should I move out? Should I isolate within the home?
I haven't seen my mom or my dad or any family members in the last few weeks.
I have some sick family members. I don't know when I'll see them now.
Can you imagine that, dude? I watch a guy on TikTok called Anki Boys. If you don't know who they are, go follow. You fucking should know who they are. But I saw a post. I scrolled through his shit, and he said he didn't see his son for 11 years. I didn't see my daughter for almost 2 months, and it almost fucking killed me. I couldn't sleep. I couldn't eat. I could not imagine not seeing my daughter for 11 years. These fucking doctors are heroes.
I wasn't able to kiss my wife on our anniversary this year because of coronavirus.
Wow! Could you imagine?
Beautiful wife and I are about to bring new life into this world, and with that comes fear, worry, and anxiety.
Both of my daughters work with me here at the Cleveland Clinic. I'm worried for the family, but we're going to do this.
My entire family lives and practices as healthcare providers in Italy. And when I read in the news that 2,027 physicians as of yesterday have contracted the virus and many have died from it, it gave me chills.
I recently got sick with a...
I believe, this guy said he got sick. I believe that guy is the guy who made that little ear cookie cutter that makes it very easy to make ears and surgically attach them to people in poor countries. That guy is amazing.
A lot of the features of COVID-19, without testing, I've got no way of knowing if I had it for sure. I don't know if I'll be infected again. I don't know if I'm going to infect my patients.
I did get corona. I was actually sick for 2 weeks, had pneumonia, and it was probably the worst health experience that I've ever been through.
I developed a fever and a lot of the COVID symptoms. When I ended up in the emergency room, all I could think about was, when I recover, will this make me immune so I can get back out there?
For the first time ever lately, I've been having this sense of uneasiness as I drive into work.
I've personally seen a lot of death that, I don't know if...
And people still make jokes to this day about people dying about coronavirus. Every time I see a comment on YouTube about coronavirus, it's like, you're going to hell. You're going to hell.
Presidency could have hurt.
God has no sympathy for you. You're going to hell. Along with Tekashi 6ix9ine.
Prepare you for.
Because our pain clinics closed down last week, and before I'll be transitioning to telemedicine soon, there's still a gap where I'll be unemployed as a pain management fellow, and that leaves me financially unstable.
So I'm still paying rent, overhead, staff, supplies, all of the above, with basically no income.
I'm a physician on Oahu, and it's challenging caring for my neighbor island patients on Maui and the Big Island.
Hydroxychloroquine has been getting a lot of press during this pandemic, and the availability of this medication has been a big concern for myself and for my patients. I've been forced to delay important heartbeat and heart rhythm procedures for several of my patients.
I lost childcare, so my toddler keeps barging into all of my appointments.
Wow.
And that's probably a HIPAA violation. Hey, I can relate. Bear walks into some of my patient visits too. Next I asked, how can we help from home?
Believe it or not everyone is taking social distancing seriously.
The virus doesn't spread on its own. People spread the virus, so you are on the front line in this pandemic.
Exactly.
Even small indulgences like going to a park around other people.
That's why we can't reopen America so soon, and so many people want to reopen fucking America. Fuck reopening the country, dog. You want to stay alive? Keep it closed for a long time.
Can have huge consequences that you don't even feel in the moment.
Treat every outside contact as something potentially infected, no matter.
I always do that, bro. I stay 6 feet away from fucking everybody. I don't trust a soul.
How healthy or safe someone or something looks.
This thing does not care what you look like, how much money you have, or how wealthy you are. So you have to stay home.
No cheating. I know it gets really boring at home sometimes, and all you want to do is just be with your friend just for a minute.
It
but
does.
Please, for our sake, stay home.
Stay home.
I don't have any friends, so this is easy.
That's how you fight the virus.
Get comfortable and stay there. Netflix and chill, YouTube and thrill.
Please, please, please stay home. Help us help you.
Help me help you.
Stay hydrated, get some sleep, eat healthy, don't smoke it. Please do some exercise while you're
I'm
home.
sorry, I already did some smoking, Dr. Louis A. Espina. I'm sorry, like, I already did smoking in this video. Like, I smoke to begin with. I wouldn't say I'm a chronic smoker. I definitely am not a chronic smoker by any means right now, but I smoke. I can't. It's a thing. I smoke. I've been smoking since I was 13. My mom doesn't believe me, but I've been smoking cigars since I was 13, believe it or not. I'm 20 years old right now.
Here's my prescription for you.
Stay home. We are not stuck at
Hold
home.
up, let's read that. Let's read that. I saw Build a Fort.
Stay hydrated, get some sleep, eat healthy, don't smoke it. Please do some exercise while you're home.
Sorry.
Here's my prescription for you.
Clean your closet, stream an online workout, teach your dog a trick.
Stay home. We are not stuck at home. We are safe at home.
Safe at home, not stuck at home. And please treat everyone with kindness.
Everyone knows someone who is putting their life at risk by working during these difficult times.
Just 3 people,
send them a thank you.
I know.
Continue
4 people,
sending positive
including me.
vibes and continue reaching out to those who are in their support system, who need their help.
And just be kind to each other. Everyone's having a hard time.
Physical distancing is crucial, but it should not cause social isolation.
Call or FaceTime your friends, your family, your significant others.
The virus mainly infects through mucous membranes of the eyes, nose, and mouth. So even if we wear gloves and we wear masks, if we touch our face, we can still get infected.
Washing your hands. And no, I'm not just talking like, oh, wash, and you're done. I'm talking a full 20 seconds. Wash your hands.
Bruh, before this pandemic, I'm gonna be honest with you. You're gonna think I'm disgusting from this. I don't give a fuck what people think, but before this pandemic, I would rarely wash my hands after I go to the bathroom. Every time I took a piss, I never... this is gonna sound weird, it's a doctor video, but I never touch my dick when I take a fucking piss, so I never feel the need to fucking wash my hands after I take a piss. But now, I don't care. I flush the toilet, I wash my hands. 20 seconds. Do it, please.
Multiple times throughout the day.
Really diligent hand washing.
Wash your hands, and as I say to my 5-year-old, don't your nose.
Be wary of the browsers and the pickers at the grocery store. You know what I'm talking about, those people that are picking up avocados and putting them right back.
By being very careful of your internet hygiene, because spreading false information.
I try my best. Like, I've done it before at stores. I pick something up and put it back down. I try my best when I'm at the store to just get what I need, just pick up what I want, and go. Like, that's what I try.
Information can be deadly.
I've also fell victim. I really don't want people to do this, but I went to Rite Aid last night, and I forgot my mask, and I was way too far of a walk ahead. I just remembered. I was like, oh shit, I forgot my mask, and I just remembered it when I got to Rite Aid, so I had to hold my shirt up the entire time I was looking up. I was looking, my shirt was so tight, I was looking at the floor at the cash register, handing them my money and shit like that, telling them to stay safe and shit.
Everyone has a role to play in making sure that we spread correct information.
Stop spreading misinformation on social media. I think this is very important.
Just following credible media outlets. Don't give in to the hysteria.
Top thing on my mind is remembering to stay flexible and lean into uncertainty.
Have those difficult end-of-life discussions. You will feel at peace
Need a
knowing
bit
your
of mic.
loved one's wishes
Sorry.
when the time comes tomorrow.
I don't want to shit on you, but I can't hear you.
Ask neighbors to put up a red piece of paper in their window if they need assistance immediately. A yellow piece means I need help but not urgently, and green means things are okay.
And please know that, like, when the scientists are saying these things, we're not saying them because we're out to get you. We're saying them because we care about you.
That's right. We're on Team You. All right, my final question. What gives you hope?
It gives me goosebumps when I think about what you see around you.
The doctors, nurses, social workers, respiratory therapists, environmental services.
Each and every one of us is doing what we can.
It's the fact that I have a great ICU team. I have the best ICU nurses in the world.
The unity, the compassion, and empathy. Humanity exists, and we're all in this together.
I live in New York City, and every night at 7 o'clock, the entire city breaks out in cheer and applause for all the healthcare workers.
From
families who are having more family meals, more family meetings. They're playing board games, they're communicating, they're talking.
People are coming together and they are helping out.
I know that for a fact. Like, my baby mama tells me she's changed so much during this quarantine and everything like that, and I can tell. I've seen my daughter at least like 3 times in the past week, and it means the world to me. And she says she's changed a lot, and I can see it.
Their neighbors.
Letters like.
Alrighty guys, unfortunately I gotta end this video early, but if you want to watch the rest, please go to Dr. Mike's channel and do so. So, like if you enjoyed, subscribe, see you guys in the video. Don't forget to turn on post notifications and leave a comment and share with your friends. Peace.